doctor.
Each year, thousands of South Africans embark on adventures abroad, trotting the globe for work and leisure. As a former Miss SA and fashion model, Tatum Keshwar does way more than her fair share of international traveling. We sent her in search of some very essential travel health information.
People say we are 100 times more susceptible to getting colds and flu when traveling.
Any crowded situation, a bus, a full train, being on the underground in London, for example, certainly puts you at risk because some diseases are spread by droplet infection. Others, of course, can be contracted from touching surfaces that have been infected with viruses that hang around for a long time. So in the last big flu scare, people realized the importance of barriers, and that includes things like hand washing, not touching surfaces, etc. In planes in particular, that's been controversial because people are stuck in a plane for 4, 6, 12 hours sometimes. People are concerned about the air conditioning. In fact, the air conditioning on the planes are extremely sophisticated and very often much better than the air conditioning found, for example, in this clinic.
As with any surface, you come into contact with germs. How can we avoid this? What can we use?
Something that's very useful is to carry a waterless hand wash. A little hand wash like this is perfect. You just spray it on and you rub your hands nicely, and that will get rid of the germs to a large extent.
But many people talk about DVT.
DVT stands for deep venous thrombosis, and that means literally that you develop blood clots in your veins, and that is a complication of any cramped form of traveling. It's not just flying. The big problem is when those clots that are lodged in your calves dislodge, they become loose, they will shoot up to your lungs and block the blood supply to your lungs in a very simple way, to put it very simply, which of course can kill you. The real risk comes in with flights longer than 4 hours, so it's extremely important on those flights. Certain people have got pre-existing conditions that puts them at increased risk. That would be people who've had a previous deep venous thrombosis, people suffering from certain forms of cancer, pregnant women, smokers, in which case it may be worthwhile taking additional precautions.
Practicing a number of exercises in the comfort of your seat throughout your flight can improve your circulation. This can decrease your risk of suffering from a DVT-related complication. Wearing comfortable clothing and walking around is also a good idea.
Doctor, what vaccinations do we need to get in order to travel well?
There are really only 2 vaccines in the entire world that are compulsory in accordance with the regulations laid down by the World Health Organization in the International Health Regulations. That's for yellow fever and for meningococcal meningitis.
Are we putting our health at risk by traveling?
I think we can summarize it in 3 simple things to remember. It's watch out what you bite into, watch out what bites into you, and watch out what hits you. 3 simple lessons. Watch out what you bite into, that's food and waterborne disease. So remember, cook it, peel it, boil it, or leave it. And in that way, you'll make sure you do not contract traveler's diarrhea, hepatitis A, typhoid, or cholera. The second one is watch out what bites into you. And that's things like mosquitoes that'll give malaria, dengue, chikungunya, animals that'll give you rabies. And then, of course, the last one is what hits you, and that is taxis and AK-47s. So be aware of your environment and travel safely.
You should also ensure that your immune system is fighting fit with a balanced diet and boosters like Airmune. Safe travels.
Hello, doctor.